Well, good morning, everybody, and welcome to the second of our thematic innovation ecosystems on digital health and data. We're just letting some people come in, grab their chairs, sit down at the desk, and make themselves comfortable. We've got a packed program today, and today we're focusing on the use and how we get SMEs working better around the field of AI and data, using what we've got in Europe now, which is a new network of European digital innovation hubs. So we've got input from a couple of those digital innovation hubs who are our ecosystems of the ECH Alliance today, and also some content from a working group that helps to combine the work of those, and also input from our Digital Health Society, our data arm of the ECH Alliance. Just by way of a little bit of a intro though, for those people who don't know me, my name is Andy Bleaton. I'm the Communities Director for ECH Alliance, the Global Health Connector. We're a member organisation with over 1,100 member organisations across the globe. We bring those members together in ecosystems in over 80 locations, ranging from Argentina through the US and Canada, across Europe. We're opening up a brand new network this year within Africa, India, Sri Lanka, Singapore we've just opened up, as well as in Australia. But specifically in Europe, we've got a network of ecosystems that are very strong around digital innovation, and a number of those are now classed as European digital innovation hubs. Many of you would have heard the phrase EDICs, and we can see many of the people on the call who are involved with those as well. So we've got specialists from our ecosystems in Finland and Portugal, but also we brought and welcome colleagues from the European Commission who are very much interested in this field, to give an idea of where there are opportunities to collaborate and learn from across those regions, and give better advice to SMEs who may be slightly nervous around getting involved with AI and data, certainly with all the legislative issues, and looking for guidance. We think those ecosystems, those clusters, are well placed to do so. We'll put information in the chat function about where those ecosystems are. I'm keen to kick off today and hear from our first of our panelists, please.
Well, thank you, Andy. My name is Sebastian Meyer. I'm a Dutch professor living in Sweden, to make it more complicated and even more European. I have the honor to coordinate the European working group on digital health between the EDIs or the EDIHs. This working group is particularly built to collaborate across all the EDIs, and the EDIs are regionally oriented or sometimes nationally oriented, and very often in a particular industry or theme. And health is one of those themes, and what we observe is we have a couple of EDIs in the network that are purely focusing on health. There are also some that have that as one of their targets. And we all know health is a little bit different. It's different from moving mangoes from Costa Rica via supply chain to Europe. It's something that combines medical logic. It is highly social, and it's also important to people, and it comes with a different set of requirements. And therefore, the innovation system around health is very often very particular. Trying to help the EDIs to learn from each other, reach out to SMEs, and therefore this collaboration and this webinar was very timely to also see, like, where do the networks overlap and what can we do as EDIs for the members in the ECH Alliance. Therefore, a very good opportunity to share experiences. We have two EDIs that present here, very good examples. One on the other side of the water here in Finland, and one in Portugal. And with that, I believe Levin would take over and tell us about the ECH Alliance.
So we've, as I mentioned at the beginning of this, we've got a data arm within ECH Alliance. I'm not going to talk any further about it because I've got an expert on this, Bleddyn Rees.
So good morning, everyone, and it's a pleasure to speak to you all this morning. So very quickly, an introduction to the Digital Health Society. And, oh, hang on. Sorry, it's not moving. Okay, so what is the Digital Health Society? So it was created in 2017 as part of the Estonian presidency of the European Union, and they held an event in Tallinn to launch it. And at that event, it was multi-stakeholder, and you can see from this slide a list of all of the stakeholders that are really necessary to transform health and care. So patients, citizens, consumers, policymakers, healthcare providers and professionals, university and research centers, and then variety of different companies, from insurers to technology to healthcare providers to automotive to energy, industries that people don't necessarily associate with being involved in healthcare. So what does the DHS do? Well, it's got a number of activities, a lot around thought leadership activities focused on digital health. And I'll say a little bit more in due course about the Roundtable program. But also we're involved in international events. So we have our own 2-day virtual summit. And we have, as an example of an international event, the United Nations General Assembly Science Summit, where last year we did a 2-day event on healthcare. And we will be doing that again in September of this year. But we're also involved in the digital and data activities of the ECH Alliance Global Health Connector. And that really is around 4 themes. And those themes are healthy aging, women's health, green health, as well as data and digital. But we also get involved in providing expertise to EU funded research projects. So if any of you are looking at doing projects and think, could we help you in terms of either our technical expertise or dissemination and communication, we're always open to offers for that. Another example of our work is the AI Club. And again, I'll touch on that in a later slide. And then finally, some of the, just about what we're going to be doing in the future, we're looking at launching hospital clubs, which would be about benchmarking and collaborations for innovation and research and commercial activities. And I think that there could be different types of hospital clubs. So for example, children's hospitals, cancer hospitals, or academic and health and science centers. So an example then of the Roundtable program. So in 2020, we launched a whole program, and that program consists of 30 to 40 individuals coming from all, again, a selection of stakeholders, and really with a written brief around a topic, then 1 3-hour virtual meeting with a briefing paper, a keynote, and then a summary, and then about a month later, a second roundtable, followed by a published report. And initially, the idea was to influence the design of the European health data space. And turning then to say, what does it look like? So the very first 2 roundtables created the calls to action. And in front of you on the screen are the 7 calls. So very quickly, raising digital literacy skills for all stakeholders, generating value for trustworthy real-world evidence, accelerating interoperability, demonstrating the benefits to society from data access, use, and reuse, adopting a risk stratification approach, building a trustworthy framework for access and use, and then 7, finally, adopting a transformational approach. So many of you, I'm sure, will think, well, okay, those are sort of quite generic, but behind this work is some great deal of detail about how to do this. And on that point, I'll show you, here are the published reports. And so far, there are 6 published reports from the roundtables over about a 4-year period. And the QR code is you can quickly use to be able to download and read the reports. And then the last 2 on the right-hand side of the screen are examples of how we take the 7 calls to action and we deep dived into particular subjects. One was immunization information systems across Europe. The other was something we call a societal compact, which is very much about ensuring that you have access to data in a safe way, that the uses of the data are acceptable and ethical. And that gives you a feeling for some of our thought leadership work. So then turning to the AI Club. So during the roundtable programs, a group of technologists asked if they could meet separately to discuss AI. So we set up a meeting and discovered that there was a real appetite amongst that group to actually meet in private and talk about challenges that AI was raising. And you can see from this slide the 4 themes that they looked at, which were use cases and evaluation, AI explainability for citizens, AI competencies and education in healthcare, and then safety and bias. And again, at the end of last year, we published a report, which you can again access via our website, all about the work that the AI Club undertook. So then turning quickly to events. So some of you may be very familiar with the health event in Las Vegas that attracts over 10,000 people. We've been a partner with Health from the beginning. We have a partner program at the event, and we also have exhibition space. And that space we call the Village, which we launched last year, as the single entry point to meet all international businesses on the exhibition floor. So there are booths, and there's a mini stage that booth holders can present on. And for us, if anyone's interested in either becoming a sponsor of the Village or buying a booth, please reach out to us, because for us, it's about taking innovation from the rest of the world into the US market. And then another event is, as I mentioned before, the Virtual Digital Health Society Summit, a 2-day event that last year attracted over 1,250 registrations from 95 countries around the world. And for us, what we're really interested in is anybody who wants to become a sponsor of the event. Again, just reach out to us if that interests you. And then just wrapping it up, if you want to subscribe to our newsletter, here's a QR code. And then also, if you want to become a member, there's a QR code there. We are a membership organization, so it's important to us that we continually grow that membership globally. And with that, I'll say thank you very much. And my contact details are there if anybody needs to speak to me, and you'll have the slides, I'm sure, as well. So thank you.
Thank you for that. And obviously great opportunities there to get involved in a number of our initiatives. Certainly for many of our ecosystems, the event in Las Vegas is a great opportunity to bring clusters of successful companies who are ready, almost, oven ready to hit the US market. So great opportunity there. Contact me if you're interested in finding out more, also about membership as well. We talk about ecosystems. One of the great things about our network of ecosystems, and there's over 80 of them now, is that many of them are already involved with the European Digital Innovation Hub network, such as the people we've got speaking today, but also in Malta and in Croatia, etc., and other countries too, such as Spain. But today we can't do everyone, so we picked what we think are 2 of our outstanding ecosystems. Certainly the best one that I would like to bring up right at the beginning is our ecosystem in Portugal, Health Cluster Portugal, which is led there by colleagues, including Patricia Petrao, who's the Innovation Director. Patricia, the floor is yours.
Thank you, Andy, and thank you so much for the invitation. I'll share my screen now. So now you're just seeing the screen, I guess, and now you must be seeing the presentation, right?
Wonderful.
Okay. So thank you so much, and thank you for those wonderful words about our ecosystem. So first of all, just to let you know that I'm here representing the Health Cluster Portugal, and the focus of my talk will be, of course, about our digital innovation hub. This has been a learning process for us too. I think this format, this new format that the European Commission has devised on digital innovation hubs is very interesting, but also kind of challenging for us to adapt the way that we have been thinking about digital health. And of course, we have become active in this process also very recently. And so what I'm about to show you is the beginning of a process that we expect that persists beyond what we have now as a funded European project. So the idea is that we can really have a structure that persists beyond the time frame of this project. So just very briefly, I just wanted to introduce you the cluster, the Health Cluster Portugal. We are a cluster organization, so a cluster association, a not-for-profit private association, which aggregates more than 230 members now. And these range from universities, R&D institutions, hospitals, and in Portugal, we have both a very strong national health service, but also very important private hospitals. And we have, as a cluster, also been trying to bring these two together in a nice conversation for the benefit of patients. But we also have a lot of companies, and this is a depiction of our very different members in this map from Portugal. And these companies might be really small micro companies, but also very important multinational pharma companies, medical devices companies. And we also have a small representation of patient organizations and healthcare professionals that we want really to increase because we know that the importance of having this kind of partners for the development of good solutions in health. So how I can start about the whole history of the Digital Innovation Hub for the Health Cluster Portugal. Actually, we started because in 2019 we devised this strategy for the cluster. So these strategic agendas, which very clearly include digitalization and data as key for the development of our ecosystem and for the integration within the national trends. And we have been very focused on a few projects like the development of a data lake, a health data lake in Portugal, that again brings together data that are not only in the private healthcare providers, but also from the public sector. And also one of the focus of our flagship projects of our cluster has been value-based healthcare and how to implement value-based healthcare in all really in all healthcare settings. And this is has actually turned into a national pilot. So the work that we have been doing during the last couple of years with around 10 healthcare provider facilities and of course physicians and healthcare providers in general has become a national pilot project that is now starting to be implemented by our national executive direction of the national health system. So all of this kind of set the stage for when this call for digital innovation hubs was out for us to understand. And as Sebastian has already said, this is really, we know that it's really different about health, and it's not only about digitalization, about the digital skills, the technical applications. So we were really convinced that it would make much sense to have a digital innovation hub focused in health. And so that's why we gathered some of our partners. These are longtime partners of the Health Cluster Portugal. Most of them are members of the Health Cluster Portugal. And we really were very committed to create this digital innovation hub that could work on this 4 different categories of services, like access to experimentation and testing, support to find investment, skills and training, and ecosystem building and networking. These are like the pillars of this digital innovation hub initiative, to help SMEs to really bring their solutions and services to market. We had some experience from previous projects. We have like a kind of a subcluster in which like every other week we meet online with a number of companies, but also healthcare providers and research organizations, and we actually try to foster the development of projects and solutions that are co-developed by these organizations. Because sometimes what we feel is that these small companies are very focused on the technology, on making the best out of their products and services, but then they tend to forget things related to what I think is one of the topics of today's webinar, that is about how to integrate their data into existing platforms, how to make their solutions interoperable with other already in place solutions, how will these solutions communicate, and also some other regulatory issues, ethical issues that are really important when we're thinking about health. So this has been our major effort. So, for instance, when we're now preparing a webinar series, a brand that we have been working on since COVID-19 pandemic started. So we were really active on giving content to people in what regards to health technology and digital technology. And in 2020, we started these webinar series, which we call Join Health. And we have now incorporated this brand, this Join Health webinars, into this skills and training category of the DigiHealth PT EDIH. And what we really want to do is not to focus only on the technology. So this is a digital innovation hub that is focused on AI and cybersecurity. We have very strong partners on these 2 digital skills, but then we really want to move forward with the business related part. So how to access the market, how to get your solution reimbursed using the available European and beyond frameworks for reimbursement, and also how to get your solution into the international market. So this is also some of the activities that we have planned for this digital innovation hub. Again, we have a very simple way of SMEs to integrate in this digital innovation hub, or to benefit from the services that we are organizing. So this QR code will lead you to our European website, where you can see some more information about our services, the partners, but also a form that can take you to this more detailed information about the services. So the thing that we what we're doing is that if a company wants to know more about the services, or realizes there is some opportunity within this digital innovation hub, you just have to fill out this form, and you'll be contacted by the cluster, and we will work as a broker to put you in contact with the right partner for your needs in what concerns the digital innovation hub. And I think I'll stop here, and we'll have time for discussion later. So thank you so much. And
thanks, Patricia. Yeah, whilst I've got, because I can do this, whilst I've got you there, is obviously some of the companies that you work with. I'm just thinking of Yako and from what the European Commission need, that down to the ground level of connection. What are some of the companies that you deal with struggling with the most around? Do you think within Portugal?
Yeah, I think before that, I think some of the companies don't even know they're struggling with something. So I think our first aim is really to create awareness for these companies that, okay, there is the European health data space regulation coming up. There is an AI Act that might have implications for the MDR that you already know. There are some ethical implications that you might not be so aware of. So I think this is the first thing that it's kind of an effort that we want to put, is to create awareness for this kind of things. But I really think that interoperability is a problem for most of these companies. Again, they're very focused on their technology, on making the most out of their products and services, and to make them really strong in terms of technology and the research behind it, because most of the companies are coming from a research setting, from academia, from very enthusiastic people that have a very strong research background. But then there is less awareness about this more practical things like interoperability and how to connect with other already existing platforms. And we have been working also a lot in the secondary use of data, and we know that the European health data space will also facilitate some of this, some of the work that can be done with data that has been or will be collected from these devices that are being generated. But again, we really have to make people aware of this. If I may add, there's also something that I just remembered. So about proving the value of your solutions. So the cost benefit analysis that are a reality for pharmaceutical industry. The frameworks, as you may know, are not so well developed when it comes to digital therapeutics and digital medical devices in general. And so this is something that we are kind of in the front of not only developing these frameworks, but also helping companies to get access to these as they are developed. So one of the members of our cluster of our digital innovation hub is Value for Health Collab, and their executive director is part of the advisory board of this task force for the harmonization of the health technology assessment for medical devices. And this is something that, so it's being built as we speak. So, and it's really important for us to be at this forefront of what is being developed to give this knowledge, to share this knowledge with the companies also that get in touch with us. And sometimes what I get from companies is that, okay, I have this really nice solution here, and I have a lot of physicians that are willing to take this on and to integrate it in their everyday work, but then I cannot convince the payers to do it. So I cannot convince the hospital board to pay for this. So we really need to have those cost benefit analysis and to understand what does this mean also in terms of value for people, for patients. And I think that's one of the things that these digital innovation hubs are also good for.
I think, yeah, I get that. And I think the other thing is to bear in mind that, you know, we don't need to reinvent the wheel.
Yeah.
What happens in Portugal is obviously going to be as relevant in Sweden, as relevant as in Croatia or Romania. And I think that benefit, and I just for those people who are not aware of it, flash up where we've got our ecosystem network. So we've got an expansive network of ecosystems across Europe, many of which Patricia is well connected with already. But also outside of Europe as well, because this is important outside of Europe too. And I'm really delighted we've got one of our ecosystems from Chile, from Latin America, also on the call. Good to see you, as well as many other people on the call as well. That network is an implementation network. Okay, this is a great network for which to make those connections with potential payers, potential providers, but also testing out your products, your company's products outside of one network into another. So whether that's in Portugal with a fantastic work there with Patricia, or indeed over in Finland, where we're going to head to next and hear from Henrik from the health hub in Finland. Henrik, tell us what you do over there in Turku, and fascinate us with what you're doing with SMEs there.
Thank you, Andy. Give me a minute. I'll share my screen. Yes. Can you see my presentation?
We can, and it's full screen. Perfect.
Yes, perfect. Thank you, Andy, for having the opportunity for me to discuss and show you a couple of concrete examples on what we're doing in Health Hub Finland, EDIH. So my name is Henrik Honkanen. I'm the project coordinator employed by Business Turku at the moment. I've been coordinating our Health Hub Finland ED for a little bit more than a year now. And as many of you might know, Finland has been quite the forerunner in implementing digital health solution and what comes to utilizing health data as well. So hopefully I will be able to provide you some sort of interesting examples on what we're able to do within our local legislation and within our project as well. Yeah. Perfect. So who we are. We are a group of 8 partners located all over Finland. We have quite a nice mix of educational institutions such as the University of Oulu and the Kajaani University of Applied Sciences, as well as a nice mixture of regional ecosystem companies such as Business Turku, Business Oulu, Kuopio Health, and Business Tampere. And then last but not least, we have also a couple of entities that are able to or are holding access to health data. For example, we have the Wellbeing Region, Wellbeing Services County of Southwest Finland. Their clinical, Auria Clinical Informatics Department, also known as former DIH. They have access to the health data of Southwest Finland citizens. And then we have the Finnish Biobanks Cooperative, which has access to the Finnish biobanking data. So what we do in this project, we put all of the most interesting services that these partners have to offer. We pool them under one entity called Health Hub Finland. And if someone would want to describe us in one sentence, we sort of describe ourselves as being the one-stop shop for health innovation services and health data in Finland. And here on the right, you can see our 4 different services that we have. They're quite the familiar service categories that most of the EDs in European Union have. And let's start with if we start with the testing category. So under our testing category, we have pulled together in total 22 different services that we can call test before invest services. And these services range from different sorts of testing environment, let's say testing environments in Tampere, Oulu, or then at Varha. But also we have different sort of services included here as well, such as the Aika supercomputing ecosystem service and the FinGenius services under FinBB. So it's quite a nice mixture of different services that we've pulled together. I know there's quite a lot of services, but what the kind of idea here in our project is that we can with the help of our partners, we can kind of help you to find the best service fit for you. And then in addition, we have health data. As mentioned, we have them through our Varha and also FinBP partners available. And then in addition, we offer different kinds of trainings, courses, educations around health data, bioinformatics, and sort of digital economy and that sort of things. We have pulled them together and then also offer these to our SMEs as well. And we also support our clients, our customers in getting access, getting access to finance. We help them we educate them about different sources of funding. We connect them with venture capital and different entities and provide them also information about local, national, and also European level grants as well. And last but not least, we have our networking services where we help our clients to kind of match make with different networks that we're part of. We help to find them if there's a right within those networks, if we can connect them to a right partner depending on their need for a network. And here I've actually listed 3 different services with a couple of examples where I think different SMEs could benefit from. These, as said, these services are available for Finnish SMEs as well as European SMEs. So it's really our pleasure to be able to provide these environments, these services for international customers as well. So the first service that I want to sort of show or discuss a little bit more about is our pop-up clinic. This is a quite recent service that we just launched in February this year, and it consists of free consultation services by our Health of Finland team of experts. And what is the kind of the benefit or the real value provided by this service? So within one meeting, whether it be physical, whether it be an online meeting, the customer is able to get a hold on at least 4 experts representing 4 different university hospital regions in Finland. So within one session, the customer is we're able to sort of analyze the need for a customer and then provide them a sort of tailored service package suggestion based on the discussion that we've just had with the client. I think this is a really nice way for a customer, let's say whether you're located in Finland, in Europe, to get a hold on a group of experts really fast and easy under one window. So I definitely encourage all of you to get on hold on us and see if we can schedule a pop-up clinic with you. And as said, it's open for Finnish and European SMEs as well. And another really great service that we have under our consortium is the Aika Arctic Data Intelligence and Supercomputing Ecosystem in Kainu. Under Aika, they're offering companies, SMEs, access to the Lumi supercomputer, which is located in Kajaani, close to the Kajaani University of Applied Sciences. And as well, under Aika ecosystem services, the experts in there, they can help you with providing support for business digitalization and also data analytics and artificial intelligence. So this is, I think, quite a unique service, quite a unique environment that we have in Finland. And there aren't that many supercomputers to my knowledge in the European Union. And Lumi and Aika has been one of the first ones to offer these services to SMEs as well. And then last but not least, we have a customer example from our DigiCenter Northern Savo, located in Kuopio region, so in the south or eastern parts of Finland. So what the DigiCenter Northern Savo did in this case, what they did for the customer. So it was a co-development project where the experts under DigiCenter Northern Savo, which are actually AI researchers working at the University of Eastern Finland. So they helped the customer in developing sort of this AI, integrating an AI, conversational AI into a chat window for our customer. And this work was directly subsidized by ED funding. So it's our pleasure also to say that we have been able to directly help a client here to gain access to a really great service provided by researchers, university experts through our help. And I think the final thing that I like to promote here is that I've now talked to you about different testbed services or pop-up clinics, and what we hear in Health of Finland, what we are able to do, we can directly subsidize those services for you. And this does also apply to European companies as well, not just Finnish companies. And last but not least, if you want to stay informed what's going on in our consortium, visit our website at healthoffinland.eu. We have a LinkedIn page where we're quite active, and then below you can also see our contact information if interested.
Thank you for that, Henrik. Very informative. Again, I a quick question for you before you should. What if you could have one, looking back from when you started this, looking at it now, obviously still quite a new concept, but if there was one thing you thought, if I'd known this when we originally applied, I would have added something, additional to our plans, what would it be? Do you think that is there still something that the scope of the EDIS is yet to focus on, or do you think it's yet to be fully explored?
I think now what we have seen lately is the kind of our companies, customers, everyone is getting interested about EU regulation, AI Act, Data Act, and EHDS. And I think we in Finland, we have, what comes to EHDS, we have been quite active in that field as well. Quite a good of example. But I think there needs to be a lot of more discussion about from a company, customer, SME perspective, as well as from a healthcare provider, or kind of all perspectives should be included. And I think this is something that we should, all the EDs or health-related EDs as well, should be talking a little bit more about, because I think this is going to be relevant. This is going to be something that we can all unite, or we are all concerned or consider or need to take into account on the new EHDS regulation, AI regulation, and data regulation as well. So I think that is something that we should consider ourselves in the future. And it would have been nice to already sort of have been more aware of that and have more activities around that as well before, or in the first 2 years that we've been running here.
And obviously within your network, you've got colleagues that are on the call here from Portugal, but also we've got fantastic representation from Greece also listening in. They're very much linked up with this too. We've got Angelina Koulibaly on the call as well, who's very involved with this as well as many other clusters. So thanks for that, Henrik. What I want to try and do now, we've heard from two very good country-specific digital innovation hubs. I want to come back to where did all this start? So Jaakko, good to have you to join this call. Just by a bit of a background, Jaakko, if you could, what was the thinking behind this European Digital Innovation Hubs network, and also what was the itch that you were trying to scratch with this? So what was the problem? Because obviously you got a helicopter view on this, please.
Yes, all right. So as we know, so there has been kind of this collaborative research concept has been prevalent in the Commission over the 40 years. So this is a kind of Brussels-centric, if I may say, more or less a kind of research ecosystem. Now the concept is that we try to assist the local ecosystems where the collaborators are typically within the walking distance, and there is lots of innovation is happening there, and that's I think the core part of the EDI is what we try to do together with the member state ministries and the local funding organizations. So we are very much integrated to the local systems that has been taking place for tens of years there. So and also the hubs, many of them have been operating for a long time, so we don't start from scratch. There's also at the Commission some history of the digital innovation hubs, and which was kind of predecessor of the current. So and also the Parliament has noticed, and there has been recent discussion that we need to support even more the SMEs. etc. But I think that's more or less the kind of helicopter viewpoint. And then concerning the implementation of the EDIs, so we have currently 151 EDIs, and now we are getting the associated countries, 7 countries more. We will have Ukraine, etc., Moldova, and in the south, and so this will take place. And the overall budget today is 314 million euros, plus then the other part, which comes from the member states, I mean, from the funding agency, private funding, from the cities, and etc. So all countries have organized their funding themselves. So it's more than 600 million euros at the moment is the current volume. Okay, that's in a nutshell. And Henrik already mentioned the kind of the services. I mean, just before invest, access to finance, networking, and training. So I'm not going to talk about that. And then a little bit about this working group, EDIC working group on digital health. So it's led by Professor Meyer, and the Commission services are at the rear seat. So we try to support, and we're not driving that. And there are obvious reasons. So we see that if the thematic network is running, I mean flying, then this would be the then it's their advantage. It's not the kind of Brussels-centric driven. It is driven by the EDIs themselves, and this is the kind of proposition we try to promote. And then concerning the working group, so we started in May, and okay, I will give the floor to Professor Meyer if he wants to say some words after my. And so after my intervention, so we have organized a few webinars, and there's a series of webinars this spring as well with various actors. And but I would like to say some words. So what I was hearing is that what are important: the access to market, reimbursement, and the solution to international markets. So maybe we could try to develop something together. So the EDIC concept is evolving, so we need to listen to each other. We all need each other to make this happen. And this also needs some leadership. And that's why we think that, okay, the Commission can support. So we cannot be the leaders in a space where that is business driven, and it's also healthcare service providers driven. But we can actually try to catalyze this process. And the forthcoming webinars are addressing these points. And what the role of the Commission is here. So we've been thinking about that. So the healthcare services are entirely the competence of the member states. The Commission cannot basically intervene unless we can support some types of outsourcing of R&D services, like the procurement, innovation procurement, public procurement for innovation, things like that. And this is what we try to do in this year, and to develop this further so that everybody is on board. And in particular, what we could do is to somehow to support the service providers. So we have access. We have a history of having service providers and hospitals on board, but we need to think about how to do this. The SMEs represent part of the innovation ecosystem, the open innovation, if I could put the kind of the big picture. I mean, the big picture of open innovation has all the actors from the various viewpoints. And this is something we would like to facilitate: internal communication. I mean, we are, kind of backseat persons here, but we could also provide some resources like we're working together with the EIC and they have some resources. So that's it. Okay, I stop now. I give the floor to Professor Meyer now.
Sometimes that overview is really, really helpful. And I think certainly on some specifics, before I come to you, Sebastian, but then I think, is there a role that the DHS, in terms of that role you've got within the Digital Health Society, is there a role, do you think, around the European health data space?
Yeah, I absolutely think so. I think that we're planning to do some implementation on EHDS as part of the next roundtable program later this year. So picking up the point about the need to educate businesses of all size about regulation, whether that's the AI Act or hopefully the EHDS regulation if it passes. And I think also there's a real opportunity for us to collaborate with the ED network around webinars for that type of topic. And also this is an important subject that would make sense to have some conversations about inserting into our Digital Health Society's virtual summit in November. So I'm very keen that we should open some dialogue about that.
Okay, thanks for that. Sebastian, no pressure now then. So
No.
what are we going to do next? Because we've heard of what's gone on so far, and Jaco's laid the groundwork in terms of that helicopter view, in terms of what they're looking for, even as a backseat driver, which I've worked with Jaco long enough to know he can't help touching that steering wheel just every now and again, but as a backseat driver, the European Commission have got a role. However, what's the plan within the network?
Within the network, we need to share very simply best practices. For instance, sharing like what are the success services that we provide everywhere. What we also, well, what the core group in the network also try to drive is addressing some of the things that were not in the proposals but are very important. So for instance, pre-commercial procurement was not a very specific thing that the eddies mentioned and applied for, but we know that this is crucial in the health sector to actually get rolling. So we try to improve a little bit the general knowledge, spread best examples, but also another thing, and that is actually very important, and it's interesting to see on the attendance list some of the people that are at the same conference as I am today. Here you hear a little bit of noise in the background. Now that the European health data space is going to come into place, everyone is going to talk about how to create national infrastructures, how to create the large-scale infrastructures for exchanging health data. And this discussion is pretty much dominated by the people that do molecules and smaller, as I sometimes try to call it. All the omics, very large sets of data that are very easy to describe and also relatively easy to share, and where you have a large research community around that drives this, where everyone has an interest in, for instance, developing the next cancer medicine. But what we as an EDDI network observe is that the innovation is not just there. That's where drug development happens. The innovation of SMEs happens in elderly care, happens in making hospitals more efficient, very, on one hand, mundane, maybe you won't get famous with it, but it's darn important for the sustainability of the health sector in our society. Being a grassroots movement that the eddies by design are, what I try to do with the working group is that we become a voice in this, and that we can collect grassroots voices, and that's very difficult to get going, because on the other hand, you sit with many top-down led structures that have very good funding. So trying to balance this field a little bit up from where it actually happens, in my eyes, the SMEs and public sector view, is a very important thing to keep up with the network. So yes, I feel the pressure, but try to live up to it.
And I think it's important as well to link it back to what you said about the innovation procurement, because all those years ago when we were discussing the pitfalls of this new concept, Jaco, do you remember, of free commercial procurement? And will it ever catch on? Well, it's there. We need to use it, and it's a good way to help direct that market. But and I think help I think in terms of setting out very clearly a way to compete. But in terms of the network as it stands at the moment, you've obviously got colleagues there at the same conference. We've got some of them on the call here. Hopefully they're paying attention to both sets of speakers. But also, we've got a wider network. We've got a network that includes the UK. Jaco mentioned the Ukraine and Moldova. We've got ecosystems in both of those. It's using almost to be able to overlay that map that we've got with the network you've got and think, where have we got gaps and where can we collaborate? It's not about competition in terms of collecting football cards, etc. But I know the links that Patricia's got there within Portugal are immense and wealthy, not just across Portugal, but across all the other projects that the Health Cluster Portugal takes an involvement with, and on the work they've been doing with the European Digital Innovation Hub. But I think with you, Jaakko, do you think, is there, you know, what does the ambition look like for the European Commission, say, not so much because you can't predict the future with the European digital European health data space, but you can think, okay, in 5 years' time, the European Commission wants to see what's your ambition? Because you're an ambitious man, Jaakko.
Yeah, but some people say so, but I try to keep low profile. So, well, the point is that, okay, let's do the job, keep low profile and see what comes out. So, okay, what I could see that, okay, we don't have, this is driven, I mean, the working group is driven on their own from the roots. And then we see maybe we could fit in some of the processes, some of the resources the Commission has, but not on purpose. I mean, we don't want to drive this. We just want to listen to what the editors would like to see, what they want to do. And what I could see, what I have heard, that if we could somehow improve the solution to international market, meaning European market, that would be maybe we could try to do that. But this requires a bit more from the edits. For example, we have an idea that there could be kind of repository. We will discuss this in the webinars. But if they could, well, we established the edits. So there are some resources. Why not to use the edits actually to contact and have kind of repository of the information of the service providers? If this happens, then we could probably use the EIC resources for pitching, and the pitching is just the starting point. I mean, you can't get the contract based on the pitching, so you have to go through this kind of some processes. Pre-commercial procurement could be one, but there could be others. We don't know exactly what others, but I know that there are some others. Nevertheless, the service providers require something, and it would, I would say that it would be successful, our exercise, if we can get in 5 years from now, if we can see that the health service providers in Europe, if they have also got some training and they understand how to procure, for instance, the R&D services, and if there are some even contracts, I mean, if people have been able to sell something, I mean, the SMEs could make businesses with the European health service providers. Maybe that's something that the Commission could bring up front. They could help doing this, but we don't want to do this if it doesn't fit well. But I would like to give a challenge to the EDIs, so maybe they could work with their own service providers in their countries. They know, they're the only ones who know how the service providers work and how the central procurement units and organizations work. So to kind of establish a new network, not necessarily new. What I hear from Finland, for instance, they already have these networks. I mean, but then to give this network for the others outside the country, other SMEs, then we could probably help establishing a kind of European market for SMEs in health sector. We know that there are obstacles like I've heard some words about corruption. That's one. And also state aid could prevent somewhere, for instance, in Netherlands, they have decided to give more money for their own SMEs. So the kind of European competition is not easy, but we think that there could be some space. And if this could somehow happen, if we could facilitate this using the stepping stones and the resources we might have available, that would be fine. So, and also what I've witnessed is the leadership. We don't want to be the leaders, but we would be on the rear seat and see what is going to happen.
I think that the ability we've already. I don't think we need to reinvent anything. That's very clear. With the network that Sebastian's built, with the vision that you've got in terms of the European Digital Innovation Hub network, I think the Commission have stayed out. We've already got an existing network, as we've said, of EDIS and our ecosystems that are very, very well linked. Don't forget that talk about coming back to the health service providers, to the procurers. Because of the way we operate our ecosystems, our ecosystem model is a multi-stakeholder model. So the idea is that we bring both need and solution to the table. So we've already got within those ecosystems, whether it's in the Netherlands with the ecosystems we've got there, or up in Finland, or in across the rest of Europe, we've already got that network that use that model of working with all the stakeholders of healthcare on different thematic areas, whether it's AI or health data, to think about, what's the need and what does good look like? Because that network's already there. So we don't need to reinvent the wheel. That we've already got those existing networks that you've seen. And I think from our side, it's about using both the connections, because they are so connected. We've got so many of our ecosystems are already in the network you've built there. Why wouldn't we use their existing connections? And also then use the connections that we've got outside of the EU. We mentioned our Chilean ecosystem. We've got other SMEs from outside of Europe that want to take part and compete in the European marketplace, as they should.
Yeah. Okay. Just one thing is that we sometimes forget. So it's maybe 95% of the healthcare market is dominated by the big players, Medtronic and General Electric, etc. What I have witnessed is there are possibilities, and it has happened that and uptake has happened based on the efforts of the SMEs, and this is what we would like to do here and support. And okay, Henrik mentioned about this regulation. I think that's something that we definitely need to consider as well, and some initiatives maybe would be useful to get a discussion maybe in the webinars, but we haven't done very much in the network, in the thematic network yet.
We've certainly got. I mean, one of the questions we had in the Q&A was around how you handle different standards, different standards. And I think if the network can provide that with the webinars, and I think bringing in the input from any other input from colleagues in terms of what Bledding can bring from the Digital Health Society around the European health data space and AI, I think there's a good level of ability here, both on standards, on dealing with AI, on dealing with interoperability, and also procurement, to make some progress. And I think that gives us hope. I think that in some ways, unless we've got other questions coming in the QA, is as good as any a point at which to thank our speakers for taking part today, and thank you for your time and your input. I'd like to thank my colleagues, Patricia from Health Cluster Portugal, and Henrik also from Health Cluster up in Finland, there up in Turkey. Good to see you. And colleagues from the Digital Health Society with Bledding. And of course, great as always to speak to you, Sebastian. But as always, the icing on the cake for me today was to meet again with Jaco after so many years and hear that vision from the European Commission in terms of what they want to do, even if it is in the back, in the rear seat. It's always good to hear. And I think there's opportunities here for further collaboration, which we will help be driving as well. So thank you very much for your time and your input. And thanks to my colleagues for setting the call. Thank you very much.
Yeah, thank you.
Bye-bye.
Bye-bye.
Thank you. Bye.
Now.